Right, welcome back to Newzroom Afrika, channel 405. We are about to go live with our sports interview for this morning. Let's take you straight there. So for doctors tenaciously navigating sports medicine that is not entirely common to people of color. Now, due to our history as a country, it's usually difficult for black people to make it into certain professions, while the sports medicine Africa practitioners have not allowed that to slow them down at all. The doctors have shown that they are not about just adding numbers to the profession, showcasing their ability to serve with excellence, to such an extent that the national teams of the country rely on their expertise when it comes to treating the national squad players in both rugby and football. Now, to unpack this further, I'm joined by Dr. Moshe Magethi, a medical doctor, and he is also one of the treaters of the national teams. Doc, thank you so much for your time this morning. You know, the journey that the doctors have had so far in the sports medicine industry as black doctors is not something often that we get to hear of, especially when you get to a stage where you are dealing with national players. Can you just talk us through how it is that the four of you got to where you are today?
Good morning to you, sir, and good morning to your viewers. Thank you very much for having us. Yeah, so it's a very interesting journey where maybe let me start with us individually. Starting with Dr. Crosby Mulungwa, who is our chairman. He has done work with SASCOC. He has also done work with the Limpopo Sports Academy. He's currently the national team doctor of the under-23 football team. And then we have Dr. Jerome Mampani, who is the national team doctor of the Springbok men. In fact, he won the World Cup in 2019 with the Springboks. He also does work with Kaizer Chiefs. He also does work with the Lions. And then you have Dr. Thulani Ngwenya, who's the Bafana Chief Medical Officer and the doctor for SAFA, oversees a lot of what SAFA does. He also does a lot of work with CAF. And then you also have me. I do work with the Springbok Women National Team. I also do work with the Lions a little bit. And then I've done a bit of work with Amazulu. So we came together in 2015 and we started speaking about how in the black space there was a need for professional doctors like us to give a proper service, not just to elite athletes, but to those who come from low socioeconomic backgrounds and those who cannot afford quality medical care. It took us about 2 years to refine our vision. And then once we had refined the vision, we then decided to start. So in 2018, we came together and we've been offering several services as Sports Medicine Africa since then.
Talk to me about those offerings, Doc, specifically for those who can't afford, you know, this type of specialized healthcare is generally something very pricey.
100%. Yeah, so in fact, from day one, what we have always wanted to do is to give an offering to those who are underprivileged. And we are working towards, hopefully by God's grace, having a high-performance center in a place like Soweto. But what we currently offer right now is we do screening. And screening means you just want to assess suitability for exercise. This can be for a person who's an elite athlete and you want to ensure that they are not going to harm themselves when they start competing or when they start exercising. And it can be for an ordinary community member who just wants to engage in exercising. For example, a lot of people are not aware that if you've been diagnosed with COVID and you have completed your isolation period and you are symptom-free, you have to be screened before you start exercising, because we are finding that a lot of people are coming up with a lot of complications, COVID complications. So you have to be screened to ensure that you are suitable for whatever you want to do. We also diagnose sports injuries. Obviously, diagnosis is very important. It's like finding the root cause of a problem. A lot of people have either given up on exercise or they cannot exercise optimally, mainly because they are carrying an injury which has not been properly diagnosed. We then obviously we manage the injuries. It will depend on what the diagnosis is, and we use several different methods. We could inject something. We could use shockwave therapy. There's a lot of things that we could do depending on the diagnosis. And then, of course, we focus on preventative medicine, so we can give advice depending on whatever you are presenting to us. We treat people with chronic diseases, high blood pressure, diabetes, asthma, who want to exercise. And so we can prescribe an exercise program for them. We can give them advice on how to go about doing it. We can screen them as well. And then we take care of sports teams, of course. And then so there's quite a lot of things that we do. We can organize sporting events from a medical point of view and oversee or supervise whatever is happening in the sporting event.
So regarding the screening, Doc, is it in particular for the screening as well as the diagnosing and everything that you mentioned, in particular for those who are underprivileged, and you mentioned those that cannot afford, how do they then cover that, the cost of that, or how do you cover the cost of that? And also, can you just explain exactly what the screening in particular looks like? We've seen, athletes running on treadmills with all sorts of things plugged onto them, taking their heart rates and all of that. Is it something similar to that?
Yeah, 100%. So let me start with your first question. So how do we take care of those who are underprivileged and who cannot afford? Currently, we are doing work with the Limpopo Sports Academy, and we are taking care of their athletes at a very low cost. We are also taking care of the athletes of the University of Johannesburg, so we are taking care of the entire sporting code at a very low cost as well. But what we also are trying to do is get into a space like Soweto, where we know there are a lot of underprivileged athletes who cannot afford medical care. And we want to get to a place where we can offer them high-quality medical care at little to no cost. But that's going to need us to partner with some people. So it's work in progress. And then coming to your second question, what does screening look like? So it will, for example, depend on what you are bringing to us. Let's say you are an elite athlete who is about to compete in rugby. We are going to do an ECG, like you mentioned. So we put electrodes on your chest, and we want to see how your heart is like, to prevent things like sudden cardiac arrest. So we check the heart rhythm. It tells us a lot of things about the heart. We will do a systemic check where we check the musculoskeletal system. So we examine you. We'll examine the heart, examine the lungs, examine the abdomen, and just go through the whole physiological makeup of the athlete. We can do things like concussion assessment. There's a lot of things that we can do, but it all depends on what you are bringing to us and what sporting code you want to engage in, or what type of exercise do you want to take part in.
And in terms of the type of treatment then, so if you've gone through the stages, is it invasive or non-invasive treatment? If it is non-invasive treatment that you give, what then happens if somebody does require, say, surgery?
Right. So 90% of the injuries that an athlete or an active person will present with do not require surgery. They are non-invasive, which is why sports physicians are very important. And then only 10% will need referral to someone like an orthopedic surgeon to operate. So what usually happens is, for example, let's say you have a chronic tendinitis of the Achilles. That means your Achilles tendon is giving you problems. It's stiff, it's painful. We can do something like a shock wave therapy, and it assists in many ways to heal the problem. But then in certain instances, let's say it's a joint problem, you may need a joint injection, then we can do ultrasound guided injections. So it all depends on the problems that you are bringing to us, or we can prescribe certain exercises to you to say, okay, maybe do 1, 2, 3, 4 instead of having an injection or going through shockwave therapy. And let's do this for 3 weeks, then you come back, and we also see good results with those types of prescriptions. So It will depend on the type of problem you are presenting to us, but generally it's not invasive. There are very few cases where we need to go for an invasive procedure.
Is there an age limit to this, Doc? I mean, I know you're saying it's athletes, professional, non-professional athletes, but is there, you know, where an age limit where you say, well, maybe you should just rather not be training at all because of your age?
No. Remember, exercise is actually, it's good. It has benefits for all age groups, from childhood up to your 90-year-old, your 85-year-old. So we take care of everybody. If you have a 5-year-old who has a growing problem, we are able to help them. If you have an 85-year-old who may be suffering from osteoarthritis, but they still want to continue exercising, it's very important. We have ways we can help them. So age, you know, like they say, age is just a number.
Exactly.
With exercise, age is just a number. So it's not really important what age group you belong to.
And then, Doc, if you can just give us some advice regarding injuries. First of all, COVID-19, you mentioned the fact that if you've had COVID-19, you need to be screened before you get back to exercising. And then also, how do we ensure that perhaps you were asymptomatic, you weren't aware, or you were aware, but you didn't get a extreme version of COVID? How do we then ensure that we are healthy enough to exercise? Will it be a matter of only screening? And then the other question that I want to pose to you is, how do we exercise to avoid injury? How do we condition our bodies to not be overexposed when we're exercising?
Yeah, so I like the first question because a lot of people, like I said earlier, are not aware that if you've been diagnosed with COVID, you actually need to be screened. And I'd say everybody, if you've been diagnosed with COVID, you have to be screened before you return to exercise, because we are seeing a lot of post-COVID complications, especially relating to the heart and the lungs. So, and the heart and the lungs are one of your primary organs that are important for maintaining exercise. And so how then do we do it? Obviously, we are going to take a history, and it's a huge subject on its own, but then we will examine you. We will do some special investigations like an ECG. We will do certain blood tests that are targeted towards what we are looking for.
Yeah.
And then if all of that is normal, then we will definitely clear you for exercise. So if you have been diagnosed with COVID, find yourself a sports physician. You can come to Sports Medicine Africa, and we can screen you to ensure that you are not going to harm yourself,
Doctor,
when you engage in exercise.
Thank you so much for your time this morning, Doc. We really do appreciate it. Let's leave it there. That's Dr. Moshe Magethi. Sports Medicine Africa is where he's from, and very important work that he is doing.